There's multiple paths for someone to become victim of human trafficking. If your basic needs aren't being met, that makes you more vulnerable. And for many of the young teens or individuals that I've had the privilege of working with, those basic needs weren't being met. No matter what path we take, we're still human at the end of the day. No one should be sold. My name is Anitra Williams. I'm the Director of Nursing Operations at St. Joseph's Medical Center, a part of CommonSpirit Health. Human trafficking is wrong because it's a violation of human rights. It's modern-day slavery. In urban settings, there's hot spots. Gas stations, truck stops, hotels, motels, and even tent cities where people will often sell their children in exchange for drugs. As a society, we need to accept that human trafficking is happening here in the United States.
A lot of our kids are getting involved in this at very young ages. I have a 10-year-old right now that I'm working with. I've had as young as 9. And so I have a clip that I showed.
We see the most vulnerable walk through our doors, and they trust us.
We'll have stuff prepped for them and ready to go.
Yeah.
And then we can give them some food or clothing, just tell them about the resources, and then...
That could be a real good enticement.
80% of human trafficking victims have encountered a healthcare provider at some point during their trafficking. We have a duty to respond to whatever needs our patients have. Sometimes they need someone to ask them simple questions like, are you safe? Are you okay?
I think that the questions being asked are absolutely the right types of questions that need to be asked. Him saying, I realized I needed help, so I asked for support. It opens the door for them to have that conversation.
When I think of all the survivors that I've come to know, every story that they describe, that moment where someone identified them, it always ends with an act of kindness. We're positioned to do something about human trafficking.